what is the right age to get pregnant or how long can I wait to have babies? It is a question that many of us as women face, whether it comes from friends, family, or even ourselves. In today's world, many women are choosing to focus on their careers or studies, getting married later, or simply waiting until they feel ready to become mothers. But does age really impact pregnancy? Hello everyone, this is Dr. Sunita Arora, and today we will discuss about when is the best time to have a baby. From a biological standpoint, the ideal age to get pregnant is in your early 20s. During this time, women tend to have the highest chances of conception, easier pregnancy, and a safer delivery. However, I understand that many women at this age has different priorities, such as completing their education, building their careers, or simply not yet finding the right partner. So, is it really too late to start the family? Let's break it down with some facts. The biology of fertility. When a girl is born, she is born with a fixed number of eggs in her ovaries. At birth, this number is about 1 million. However, over time, this number gradually declines. By the time women reaches in her late 20s or 30s, number of eggs decreases, so does the quality of eggs. This decline in eggs quantity and quality, which we call as ovarian reserve. As women age, there is increased risk of genetic disorders like Down syndrome or chromosomal abnormalities because of poorer egg quality. What are the other risks of delaying pregnancy? For instance, women in their 30s and beyond are more likely to face premature ovarian failure called early menopause, often due to lifestyle factors like poor diet, stress, environmental pollution. Additionally, with age, there is an increased risk of conditions like fallopian tube blockages, infertility, ectopic pregnancies, and higher chances of miscarriage. Medical complications like diabetes and high blood pressure also become more common with age, which can further complicate pregnancy, and health of both mother and baby are affected. Older mothers are also more likely to require cesarean section during delivery. Now we talk about male fertility and age. While women's fertility decreases with age, men are different. Men can continue producing sperms into their 40s and beyond. However, just like women, sperm quality and quantity can decrease as men age, especially after 40s. External factors such as stress, poor diet, smoking, and alcohol consumption can worsen male fertility as well. So ultimately, the best age to have baby is when you feel physically, emotionally, mentally, and financially ready. While biological factors are important, it's equally important to be prepared for the challenges of pregnancy and parenting. If you are planning to get married later and want to have children later, it's essential to be aware of your fertility status. Thankfully, we now have medical options like ovarian reserve testing called AMH or anti-Mullerian hormone to help assess your egg count. If your ovarian reserve is low but you still plan to delay pregnancy, options like egg freezing or embryo freezing may be discussed with your doctor. Now, tips for healthy pregnancy planning at an older age. First is eat healthy. A balanced diet is key to maintaining reproductive health. Exercise regularly. Keep your weight in check as obesity can complicate pregnancy. Manage chronic conditions if you have diabetes, hypertension, thyroid issues. Avoid smoking, alcohol consumption, and other drugs. These habits can reduce the fertility and affect pregnancy outcomes. Late motherhood. Is it all bad? We have seen that many women are having babies later in life and still having healthy pregnancies. We have seen stars like Aishwarya Rai, Madhuri Dixit become mothers in their late 30s. Interestingly, studies have shown that older mother may benefit from emotional maturity, financial stability, and a better sense of responsibility. In some cases, babies born to older mothers are said to score higher on IQ and emotional intelligence test. So what is the conclusion? That there is no universal best age to have baby. It depends on your personal journey. If you are considering pregnancy at an older age, make sure you are aware of the biological facts and take proactive steps to protect your health and fertility. It's always wise to consult a doctor and plan accordingly. If you found this video helpful, please like, share and subscribe for more information on women's health. And don't hesitate to leave a comment or ask any question below. I'll see you soon.